Hi, Assalamualaikum warahmatullahi wabarakatuh, and good morning to Miss Aisha and all my fellow friends. Today, I will talk about the CPR. Cardiopulmonary resuscitation or CPR is an emergency procedure performed in an effort to manually maintain brain function until further steps can be taken to restore spontaneous blood flow and respiration in a person whose heart has stopped beating. This is shown in a person who does not respond by stopping breathing or abnormal breathing, for example, miserable breathing. It can be done inside or outside the hospital. CPR involves pressing on the chest to a depth of at least 5 cm and a rate of at least 100 times per minute in an effort to produce artificial circulation by pumping blood through the heat humanly. In addition, rescue can supply respiration by either blowing into the victim's mouth or using a device that pushes air into the victim's lungs. The process of providing external ventilation is known as artificial respiration. Current recommendations emphasize high quality chest compression over respiratory assistance. Simplified CPR methods involving chest compression are only recommended for untrained rescue. CPR alone is unlikely to resuscitate the heart, as its primary purpose is to partially restore the flow of oxygenated blood into the brain and heart. CPR can delay tissue death as well as extend a short window of opportunity for a successful resuscitation without permanent brain damage. Giving an electric shock to the heat defibrillation is usually required to restore a viable heartbeat. Defibrillation is effective for certain heat rhythm. Only example ventricular fibrillation or ventricular tachycardia without pulse, not associated as pulseless electrical activity. However, CPR can trigger a shocking rhythm. CPR is usually continued until the patient recovers his or her spontaneous recollection ROSC or is confirmed dead. Latest news, the Malaysian government requires each of the family members to have at least one representative who is good at performing CPR to deal with accidents. Here are some tips for the elder to do CPR. Step 1. Call 911. First, check the scene for the factor that could put you in danger, such as traffic, fire, or falling masonry. Next, check the person. Do they need help? Tap their shoulder and shout, "Are you okay?" If they are not responding, call 911 or ask by a bystander to call 911 before performing CPR. If possible, ask a bystander to go and search of an AED machine. People can find this in office or many other public buildings. Okay, for the step 2, place the person on their back and open their airway. Place the person carefully on their back and kneel beside their chest. Tilt their head back slightly by lifting their chin. Open their mouths and check for any obstruction such as food or vomit. Remove any obstruction if it is loose. If it's not loose, trying to grasp it may push it further into the airway. Step 3. Check for breathing. Place your ear next to the person's mouth and listen for no more than 10 seconds. If you do not hear breathing or you only hear oscillation gaps, begin CPR. If someone is unconscious but still breathing, do not performing CPR. Instead, if they do not seem to have a spinal injury, place them in the recovery position. Keep monitoring their breathing and perform CPR if they stop breathing. Then, step 4. Perform 30 chest compression. Place one of your hands on top of the other and grasp them together with the heel of the hands and straight elbow. Push hard and fast in the center of the chest, slightly below the nipples. Push at least 2 inches deep. Compress their chest at a rate of at least 100 times per minute. Let the chest rise fully between compression. Okay, for the step 5, perform 2 rescue breaths. Making sure their mouth is clear, tilt their head back slightly and lift their chin, pinch their nose, shout, place your mouth fully over theirs and blow to make their chest rise. If their chest does not rise with the first breath, retile their head. If their chest still does not rise with a second breath, the person might be choking. Last but not least, step 6. Repeat the circle of 30 chest compression and 2 rescue breaths until the person starts breathing or helps arrive. If an AED arrives, carrying on performing CPR until the machine is set up and ready to use. And that's only for me. Thank you.
Dah lama aku tak baca buku.
Zidane bangun Zidane. Dah punya Zidane. Panggil semua yang tahu buat CPR. Sekarang tak boleh pergi. Zidane bangun. Zidane bangun.
Hey, what is your thing today?
Dia pingsan seperti tiba.
Help, okay. Please, someone call the EMS, emergency medical service, or call the ambulance to get for help for this victim. Okay. So, firstly, okay, Aisyah, call the EMS now. Okay, firstly, the surrounding is safe from the danger, and I will check his body. He has no fracture, and then I will see in his mouth if it has something, because maybe he will talking in his mouth. Okay, there's nothing. Okay, Zidane, are you okay? Zidane? Okay, and now I will do a CPR because it's not response. Now I will do a CPR. Okay, now I will do a CPR. Firstly, 2 fingers from the sternum to press his lung. Okay, I will do. Okay, now 30 times I will push his hand. Okay. Okay. Okay, there's no nothing. I will breathe easily. Okay, now I will press 30 times. Okay, then are you okay? Okay, now the victim have response after I do a CPR 30 times and 2 breathing in his mouth. And now, is it okay? Okay, is it? What's this? What's the number? Okay, what's your name? Okay, so the incident I have know himself. I will show 1, 2, 3, and please know his number. And after that, okay, the ambulance has come, and now incident will take to the hospital. Okay, and that is the CPR. Thank you.